Welcome to Orthodontics Part 3. In this slide presentation, we will look at additional orthodontic techniques, appliances, post-op instructions, and home care. This presentation is geared toward the dental assisting student. In a previous slide presentation, Orthodontics Part 2, I discussed the sequence of appointments for the treatment plan of corrective orthodontics. In this presentation, we're going to continue with power products, hooks and elastics, headgear, retention appliances, and post-op instructions and home care. To create additional force in tooth movement, materials such as power products might be used. One of these is the elastic chain, and you can see it's a series of circles all connected together. It's rubber, and it does have elasticity. So this would create force on the teeth, usually used to close diastemas. And you can see here that sometimes it may include the arch wire, or there are some situations where brackets are placed and then the elastic chain is placed prior to the use of any arch wires. Another type of power product is the elastic thread, used very much in the same way as the elastic chain. The threads are usually woven throughout the brackets and the teeth to create pressure to close diastemas. Another power product are known as elastics, and elastics commonly are known as rubber bands. There are various sizes of the rubber bands. Sometimes companies actually determine or label the size by a theme, like maybe it's all animals or maybe it's countries. So sometimes an orthodontist might say, put on class 2 tigers, and people were, a patient might go, what? But that is a certain type, size of elastic. And elastics are used to create power for movement between the dental arches. So a class 2 intermaxillary elastic would have the elastic hooked to the maxillary anterior teeth down towards the mandibular posterior teeth. So if we have a class 2 malocclusion, then this elastic would bring power to bring the mandible forward. In a class 3 intermaxillary elastic, you have the elastic on the maxillary posterior tooth, and then it stretches toward the mandibular anterior tooth. So this creates force to move the mandible back or in a posterior position. So this is these elastics are all about getting the mandible to move into as close as possible a class 1 or neutral occlusion. Or if a patient has a crossbite, elastics can be used for additional force for a crossbite. Other corrective appliances, I am going to mention two popular ones, the HERBST and the MARA. And these two types of appliances are functional appliances for class 2 overbite. And what it does is it restricts the maxillary or the maxilla, the growth of the maxilla. And it's often said this allows the mandible to kind of catch up in the growth process. Therefore correcting a class 2 overbite. Then we also have headgear. Oh, not this type of headgear. This type of headgear, orthodontic headgear. We have one known as a high headgear, a cervical headgear, and a combination. And so these appliances have a wire that is inserted into the orthodontic tube holder where the wire holder is on a orthodontic bracket or a band, and then the strap, the head strap or the neck strap or both, then create additional pressure either to stabilize the maxilla or to move teeth distally, and certainly the orthodontist will determine what is best for the particular patient. We don't see these all that often because certainly we have a lot of developed techniques. When I was a kid, we saw them a lot. And also, people wearing headgear usually these days tend to wear it at night. Post-orthodontic treatment, there are some retention devices. One of them is called a positioner, in which an impression is made after the removal of the corrective fixed appliances, and the patient would wear this positioner that holds the maxillary and mandibular arch together in order to keep tension on the teeth and retain them in their position. Also, the use of a retainer might be used for keeping teeth in position. And then sometimes teeth just have this memory. They want to go back out of alignment. So an orthodontist may choose to place a lingual retainer bonded to the teeth. We see them most often in the mandibular anterior teeth, but there are patients who have them on the maxillary anterior teeth. If a patient is going to wear an appliance such as a retainer that has wires, those wires need to be adjusted periodically, and so two wire bending pliers would be a 3-prong plier or a 2-prong plier, often known as a bird's beak, and sometimes these points on the 2 prongs are a little bit longer. In California, a dental assistant can seat a retainer after it has been adjusted by the dentist, and of course also give home care instructions to the patient. Speaking of home care, there are post-op instructions that are very important for the success of the orthodontic treatment. So these are not necessarily just at the end of orthodontic treatment. Certainly, it's very important to review with the patient at each appointment the instructions and care of the appliance or any of the fixed orthodontic appliances that may be placed during treatment, care of retainers. Do you eat with them? Do you take them out? Do you sleep with them? All of those very important instructions. Diet is important in orthodontics, and diet really revolves around not bending or breaking an appliance. Certainly we want the patient's diet to be nutritional for their health and their growth, but we don't want them to eat usually a lot of sticky foods which can stick in the brackets and begin a caries process, or foods that would be too hard that it could bend wires or dislodge any of the brackets or wires for corrective orthodontics. And then, of course, oral hygiene is very important, and so some offices will give the patient an oral hygiene kit. They may have additional hygiene aids, rubber tip stimulators, floss threaders to be able to floss teeth around these various wires. Maybe it has some wax in case they have a situation where a wire starts to poke them, maybe on a weekend, before they can get to the orthodontist's office and get some relief. Sometimes with some of the appliances, they may have to use wax just because of the position of the appliance, the structure of their tissue. And so post-op instructions and home care are very important for the success of the orthodontic patient. I thank you very much for listening. Check out Ortho Parts 1 and 2 and I wish you success in your orthodontic studies. Thank you.